Impacts GRC meeting. Today is May 12th. I am Casey Beck, the Behavioral Health Program Manager. And thank you, Avery, for getting that recording started. I wanted to remind everyone that this is a public meeting. It is going to be recorded. Chat feature is turned off. Please direct all questions to co-chairs and grant staff. We have a packed agenda today. That's to say the least. Here are some estimations. But before we take roll, I would like to briefly note and introduce Ryan Keck as the CJC's new interim executive director, as Ken was going to be loaned out to the Public Defense Services Commission through the end of this year. And for that reason, Ryan is also serving as Impact's co-chair on the interim. So Ryan is here and has joined us, and he will likely have more to share, some more details as part of the agency updates. That is at the end of today's meeting. You can see the last 10 minutes that are hopefully reserved for that. But Avery, let's go ahead and take roll so we can try to keep time.
Sounds great. Okay. Co-chair Sam Byers.
Good morning, I'm here.
Co-chair Ryan Keck.
Here. Good morning.
Judge Shanti.
Present.
Jeremiah Stromberg. Okay. Liz Weber.
Present.
Steve Gunnels.
Present.
Eric Swallow. Chief Harnden.
I'm here, but I need to depart at 12:30.
Okay, thank you. Commissioner Hall. Alicia Beamer.
Present.
Stacy Brubaker.
Present.
Dr. Brigham.
Present.
Okay, Dr. Stanfill has noted she will not be able to attend. Senator Gelser-Bluen. Janie Gullickson.
I'm here.
RJ Navarro. Michelle Mason. Representative Choatson. Paul Solomon.
Here.
And Carl McPherson. Okay, Casey, we have quorum.
Thank you, Avery. Could you confirm numbers-wise that after Chief Harnden needs to depart at 12:30, will we have quorum after that time if everyone else remains?
Yes, so we have 11 here currently. So if Chief Harnden leaves, we will have quorum exactly.
Okay. So if anyone else needs to depart for some reason, we do have 2 critical action items today. I ask that you let Avery and I know so that we can keep track of quorum and make sure that everyone's represented fairly and equally. Okay, let's move forward. We're going to go ahead and pause for public comment. If you are a member of the public who wishes to provide a comment today, feel free to unmute yourself and speak. We'll reserve a couple minutes for this, and that begins now. Welcome, RJ. I just saw you pop in. We're currently pausing for public comment, but Avery, it looks like we might have one more committee member to add to our quorum total. All right, I am not seeing anyone hop off mute or raise their hands to provide public comment, so we will carry on. First up are some adjustment requests that we received as part of this past Q3 reporting. So each quarter, grantees have an opportunity to request, some sort of adjustment to their budgets as part of that quarterly reporting. And they could be substantive changes to a program, their budget, or both. During this last quarterly reporting, there were 6 total requests received that kind of met this threshold of above 10% of the total award amount requesting to be changed, which is the threshold that's required for GRC approval, and or some sort of substantive change. So you'll see here the respective counties that have submitted these requests, and this is all relating to the Behavioral Health Deflection Grant Program. At this time, there are no impacts amendments to be reviewed. So again, GRC approval is needed when that total request amount exceeds 10% of the grantee's total grant award. Any sort of new program or initiative is creative, a substantive change to the existing programming. And thanks to your decision back in November, CJC staff are authorized to process any other amendment that don't meet those requirements. As part of BHD programming, we are really still encouraging grantees to continue to refine their eligibility criteria and add any sort of pathways that are needed by their local jurisdictions. And so those particular changes, we are not bringing forth every single time, and that's continually happening, and we will continue to update the GRC, but those additions are expected over time. So another quick reminder about the voice voting process. So I will articulate the matter that is up for vote. There's no need for formal motions, abstentions. Anyone who chooses to abstain from a particular vote needs to announce their abstention before ayes are taken. Any sort of yes or aye would be required if you are in favor of the vote at hand, and those opposed will say nay when prompted. Those will be recorded if there are any particular split votes. So first and foremost, we have Lane County. The county here is requesting to reallocate a total of $225,000 due to some cost savings that they've experienced and some consolidation of their programming. And this exceeds 10% of their total award amount, which is why it is being brought to you all. So that $225,000 is comprised of the sub-bullets here. There's $65,000 coming from supplies to contractual services because client assistance is now included as part of an existing navigation services contract. The second request here is to reallocate $5,000 from equipment to training and travel because a large IT supplies purchase, a big printer, was not needed after all, and that funding will go towards training and associated travel for core deflection program staff. The third point here is to reallocate $180,000 from administrative to housing and facilities because the admin costs were actually less than expected, and that funding will now go towards low barrier housing support instead. And last, a request to reallocate $40,000 from training and travel because law enforcement will be doing their own training. So that breaks down as to $5,000 to supplies and $35,000 to contractual services to cover costs for a deflection consultant. Are there any questions from the GRC? Paul, I see your hands raised.
Yeah, a couple of things. One, are all these GANs effective through the end of this fiscal year? So are all of them making adjustments to their contracts through June 30th?
That's a great question, Paul. And yes, that's correct. So the current project periods for all BHD programs ends June 30th, so a month and a half from now. And counties really reassessed their current budgets to try to make sure they were spending down funds in an efficient way. And that's why I think we have maybe a few more amendment requests than we're normally accustomed to seeing come across our desks.
Great, and I'll just announce in advance that I'll be abstaining on Lane County's.
Thank you. Alicia Beamer.
Yeah, I'm going to abstain too because I'm from Lane County, but I do just want to say what a great program this is. So I will just say, even from the hospital perspective, the difference that it's making in patients that are frequently coming to our emergency departments, and how this is just really a holistic program, and the direction that it's going is life-changing and it's inspiring. And really our hospital teams are super excited about it, which I don't think everybody thinks of deflection from that perspective. So I just wanted to add that for whatever it's worth, and I'll abstain from this, but thank you.
Thanks for your comments, Alicia. Are there any other questions or further discussion from GRC members before we move into a voice vote? Okay. So the decision, oh yes, sorry, Janie, got your hand up just in time.
Sorry about that. I was looking for the buttons. I am curious, and I apologize if I missed it. What is a deflection consultant?
Let's see, Avery, maybe you, Will, or Monica might be able to pull up the amendment requests. Maybe there's more details there, but it's my understanding that it's an external expert on deflection that they were going to bring in for like basically a contracted sort of training and collaboration about their deflection programming.
I'm
Avery
turning
will-
to the
Oh, thank
adjustment
you.
now to,
Thank you, Avery.
yes.
What Avery's reviewing right now is the Lane County adjustment request, and those materials were sent out to all GRC members. So GRC members, if you were able to find it faster, if that's a-okay too, this dual screen presentation mode makes it a little bit difficult for me to navigate that.
And
Judge
Casey,
Shanti.
I can
Oh,
jump
yeah,
in.
sorry. Yeah, thank you, Avery.
And say, so what we have and what you all have is that this is law enforcement will be doing their own training, which is why it's coming from the training and shifting the budget needed for consultation costs. So it is like a deflection consultant, but that is the information that we have.
Thank you for that. I did read the information that was sent out, and it does say for contracting with deflection consultant. It just doesn't say any more detail than that. And I was just curious. I don't mean to or don't want to derail anything, but if anyone did have a little more information, I was curious. Thank you.
Judge Shanti, I see your hands raised. Judge Shanti, you're on mute. I'm not sure if you were attempting to make a comment.
Yeah, I was trying to make a comment. I noticed that too, and I just assumed it was something where a consultant would try to figure out where the holes were and how to better onboard people and get people participating. But I don't know. This isn't going to hold up my vote because I think this program is fantastic, but it would be nice if we could get a report about what it is, because who knows, maybe other counties would like to have a deflection consultant as well if it turns out to be helpful.
That sounds great. Paul, I see your hands raised, and I would encourage the GRC to, if it's not going to impede a vote, we do need to keep time and move on. But Paul, I can entertain your comment.
Great. Well, I was waiting to hear what the official response is. I am the deflection consultant for Lane County, and have been part of the design process from the beginning. I also facilitate a number of the work groups and have worked with the Lane County team through every step of designing and implementing this new program. Hence my
Thank you for that
abstention.
context. That makes sense.
So what
Thank
do you
so much for
do,
the
Paul?
Plenty. Do you want more detail than what I just provided, Judge?
I do. You said you've been with them the whole way, but what are you trying, like, what is your expertise? What are they using you for, to figure out how to bring people in, keep them in, or all of the above?
Well, so a lot of it early on was around design and how we were creating this program, where we looked at everything from the eligibility criteria that we developed, the housing components, which I think are a little unique to Lane County. But I've also facilitated our policy agenda group, which meets on, it's kind of waxed and wanes from a weekly to bi-weekly to monthly basis, to continue to refine the program as we go. In addition, Lane County has a data component where we have contracted with researchers to do additional qualitative research outside of what's being entered in REDCap, and I facilitate the data work group as well. So those are kind of the two big things that I'm involved with, and have also been a part of the cultural competency work group that we have, which I also believe is unique to Lane County.
All right. Is there any further discussion or questions from GRC members before we move to the voice vote for Lane County? Okay. Seeing and hearing none. So the decision before you now is whether you approve Lane County's adjustment request as presented here on the slide. I will formally ask if there are any abstentions. Paul and Alicia, do you mind formally saying now whether or not you choose to abstain?
I do abstain.
Yes, I do. Thank you.
Right. Any other abstentions? Seeing and hearing none. All those in favor, please say aye.
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 And all those opposed, please say nay. Right, the amendment request for Lane County has been approved. We are moving next to Lynn County. So Lynn County is requesting a reallocation of $213,238 total to fund the remodeling of the Crisis Stabilization Center. This is an existing line item in their budget, but as Paul had that great question earlier about the project period, and that is set to end on June 30th. So grantees really assessed where their money is going, where there seems to be a little bit extra or overestimated that they may not spend, before the next 6 weeks are up. And so Lynn County is requesting this move, which exceeds 10% of their total award amount, and that's why it's here before you today. There is $161,194 coming from personnel. This is due to cost savings, basically attributed to hiring delays and the challenges of hiring folks who maybe couldn't really commit to a short, limited duration position, and that could be potentially different in the future should deflection 2.0 be a thing that happens. But for now, there was cost savings that Lynn County assessed in their personnel, and they would like to change and apply that to the remodeling of the Crisis Stabilization Center. There's also a little over $1,800 to be reallocated within contractual services. This was due to an overestimation for a consulting firm that they're working with. There's $30,201 from supplies. That includes about $7,600 from printing materials. That was an overestimate, and about $22,568 for an overestimation and limited project period remaining for the deflection, graduation, street outreach events line item. Lastly, $20,000 from training and associated travel would be moved towards this contractual services line item, and that was due to an overestimation and, again, limited project period remaining. So the total request here is $213,238 to be applied towards the Crisis Stabilization Center, which is an existing line item. Are there any questions or discussion from GRC members before we proceed to a voice vote? All right, seeing and hearing none. So the decision for you now is whether you approve the Lynn County's adjustment request as presented here on the slide. Do we have any abstentions from this decision? Okay, all those in favor, please say aye.
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 Aye. Aye.
All those opposed, please say nay. Right, so the amendment request reviewed today for Lynn County has also been approved. Next up for Malheur County, the reallocation request totals $36,250, and this is with intent to purchase a vehicle to support rural outreach, participant transportation, and engagement with participants and both system and community partners. So how this breaks down is $10,000 reallocated within the equipment category because they were unable to procure a desired software for a data dashboard in a timely manner, just could not get the commitments from that software provider. The second portion here, $11,250 from housing and facilities due to cost savings because a particular individual's housing actually ended up being covered by the county's burn funding instead. So there's a cost savings there. And then $15,000 from personnel cost savings. They hired a deflection navigator and they're waiting the last steps of that hiring process, but with only 1 to 1.5 months before the project period ends, there's $15,000 from that particular line item that would not be required, and they would like to put that towards the vehicle purchase. The second part of this county's reallocation request is to reallocate $5,000 from the administrative category to training and associated travel to cover the cost of their deflection navigator attending the CJC summit back in March, as well as, the deflection coordinator who attended that summit, and then training for this new deflection navigator position. So this does exceed 10% of their total award amount. The total is $41,250. Are there any questions or discussion from GRC members? Seeing and hearing none, so we will proceed to a voice vote. The decision before you now is whether you approve Malheur County's adjustment request as presented here on the slide. Are there any abstentions from this decision? All those in favor, please say aye.
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 Thank you. All those opposed, please say nay. Okay, the amendment request reviewed today for Malheur County has been approved. Next is the request from Marion County. So during the first year of implementation, Marion County identified a need to provide both immediate and short-term housing / shelter for participants wishing to enter their deflection program. The county recently closed the former transition center, are in the process of remodeling, repurposing, and restaffing the facility to allow program participants to receive services and support in a safe shelter environment. So the reallocation request is really about reallocating funds to support that project, the stabilization center improvement project. There is $30,000 coming from supplies cost savings because the urinalysis services ended up being provided by other entities. Their movements 2 and 3 total $35,792 from contractual services. That's $18,465 in cost savings because dispatch services were not utilized as projected, and $17,327 in cost savings due to not needing a motor pool fleet vehicle lease for the entire project period because of delay in hiring the lead navigator. A $63,514 move from equipment. That's also due to cost savings due to the not needing to purchase a fleet vehicle to support the restore court. And then last, $387,669.20 from personnel. These are cost savings coming from the mental health specialist 2 position, lead navigator, and management analyst 1 and deputy. And really, again, this is just due to delays in hiring personnel, the open positions remaining. So these adjusted personnel costs will run through the remaining of this project period, but they do have this cost savings to apply elsewhere. So the total amount reflected here does exceed 10% of their total award amount, which is why it's brought to you today. Does the GRC have any questions or discussion regarding this request? Oh wait, Paul, I see your hand was up first.
Yeah, so I'm curious about that June 30th deadline. So is the expectation that all of these dollars are spent for capital improvements by June 30th? Just seems like a pretty short timeline.
Yeah, so the money would need to be like actually allocated to this project. It doesn't necessarily need to be dollar for dollar spent, but the county needs to have like basically reported, hey, we are spending this fund, like these funds, excuse me, on this project, and therefore the monies are spent. Does that make sense?
Yeah, thank you.
RJ.
Yeah, thank you. Can you guys hear me all right?
Mhm.
Okay, perfect. So when we first received this application, I expressed concern because I felt like we were approving supplanting funds that the county was already allocating to their existing LEAD program. And I feel like that's kind of coming to fruition here, where again, we're supplanting funds that the county is allocating towards their prison. This is their work center is a prison. That's where when you get overpopped out of the county jail, you go to the work center. So I mean, I think there's an understanding that yes, housing does have a place in this. I know that Marion County has other existing programs where they pay for housing vouchers for folks to go into like halfway houses while they're in recovery and while they're going through their programs. I feel like that is a better model. It's been a successful model. I know that Marion County has a really awesome SOAR program that utilizes that model. So I am again concerned for the previous reasons that I expressed the last time we heard this, and yeah, I don't feel confident supporting this because I feel like we are again just allowing uh, the planting of funds from the county to increase their jail when this is supposed to be improving access to behavioral health services.
Thanks for your comments, RJ. It is, I would say, at least staff's understanding that the transition center that you're speaking about has been closed, and the point of these funds are actually to support a project which is repurposing what was that transition center into a stabilization center where like deflection program participants would be able to receive services and support at this center. So that was what Marion County had, the information at least that they included in their request. And so that is staff's understanding.
Yeah, thank you for that. I really appreciate it. You know, that stabilization center is located in, I mean, at the very, very end out in the country of Marion County. It's not close to the community. It's not close to community-based treatments and services. To me, it's not setting up folks for success when you have to put them all the way out there to be able to receive services. But we could be placing them at the halfway houses that are located within the community so that they can access under their own, you know, power, um, other community-based and treatments and services that are there. So that's my concern. But thank you for that.
Is there any further discussion or other questions from GRC members? Judge Shanti, I see your hands raised.
So I need I guess I need a little clarification because the first part of what RJ said is important to me, or both of the parts that he said, but in particular, so they're closing down their work center, which is where they send people who have been sanctioned after committing some crime. I'm assuming that's what that was. Is this stabilization center, as we understand it, totally disconnected from that? In other words, anyone in the community can go there if someone is in crisis and they need to go somewhere, they'll be able to go there? Or is it only people that are picked up by the police and booked and then sent there? Do we have any clarification about that?
I guess could ask that the GRC turn to the amendment request that was provided. That is the information that the CJC has. So that was sent out by Avery previously. And maybe Avery, if you don't mind also looking into see if there are any further.
I'm sorry to interrupt, but I looked at it and they don't tell you. I thought maybe
Okay.
there's someone on board here that knows something about it just because there's so many people here that know about so much.
Gotcha. Okay. I appreciate that clarification. Right. I am not seeing anyone come forward. So
I got a question.
yeah, RJ.
Is there any way that we could postpone a vote until we can get these answers back? Because, you know, one of the things that made it so quick for, at least in my case, to approve the Lynn County adjustment was that it was very detailed information about why they were asking for that adjustment. And in this request, there's not.
Yeah, so to answer your question, if it's a possibility, I would say technically yes, it is a possibility. It would require quorum to be gathered as part of this committee before June 30th, which is the end of the project period. That also would not allow too much time for Marion County to reallocate the funding here. But it is a possibility if this committee could commit to showing up to make that decision. Another option that maybe could be entertained is approving it with a caveat. and either asking for supplemental information, or that it could be implemented after meeting these conditions. Or, of course, the last option is it goes to a vote, and it's just whether or not it gets approved, with those who are in favor versus those who are opposed. I think those are the options that we have today.
I think I'd be in favor of moving it to a vote, with the caveat that we do get more information, detailed information back about that stabilization center.
Okay, so RJ has recommended moving forward with the vote, but requesting more specific details from the county as to the stabilization center, possibly answering also the questions that Judge Shanti had posed earlier. Alicia Beamer, do you have any comments or questions?
No, I would second that. I mean, I would really hate to delay the opportunity to have a stabilization center in the area and being able to get that up. But I guess, RJ, I would also ask, I mean, I think we're asking for all of these folks to come back to us at some point with more information, right? And talking about their program. So I don't know if that would look, are you envisioning that to look different?
I think that I envision it being a little bit sooner.
Okay.
Just to give us
Like keeping a pulse on it. Yeah.
Correct.
Thanks.
So would that information be something that the county would provide to the GRC via email? And then if it did not meet, your expectations, how would the committee like to move forward then?
Well, I think if the condition is that they provide detailed information, and it's not detailed information, it's something that's very similar to what we kind of received, um, then I believe that the understanding would be that the reallocation wouldn't be approved.
Judge Shanti, I see your hands raised.
Yeah, so to me, it's not enough that they provide more information, because I want to make sure that what they're doing is not just moving the work release program, calling it a stabilization center, and it's still connected, that you have to have been arrested and sent off. You get that after you come into the police station or the sheriff department, and then you're booked, and then they'll take you to the stabilization center. I want to know if the entry to the stabilization center is wide open. In other words, anyone in crisis can go there. And I would totally vote for that. I'm not sure I would vote for a stabilization center that the entry is you have to go through law enforcement and the booking process to get there. That's all I want to know. So I would condition my vote on that. If we can't, my guess is people are going to pass this anyway. So if we can't get that clarified, I'll just vote no, and everyone will know the reason I voted no is because I'm against I want to make sure that it's open to everyone, and it's the only avenue isn't through law enforcement and booking, etc.
Thank you for your comments, Judge Shanti. So there is a current motion from RJ for the county to provide detailed information, which was seconded by Alicia Beamer. Judge Shanti has asked that the caveat be included, so that if this stabilization center is open to everyone, like entry to the stabilization center is open to everyone, then it can be approved. That's what I'm understanding from Judge Shanti. Sam, I see your hand is raised.
Thank you. I just want to give the behavioral health perspective in terms of how we're building out the crisis system. And I would concur with Judge Shanti. You know, the idea of our receiving and stabilization centers really are that a mobile crisis team could connect with somebody and then have a place to take that person. It is really a early intervention prior to any law enforcement. And it also could be that a police officer, encounters someone and then also can take them to the stabilization center without needing to, take any further action so that they can get their behavioral health needs met. So, having a stabilization center that was not open in that way would not align with the statewide crisis system that is being built out right now. So I just think clarity around that will be critical to move forward, just to know that this isn't a specific entry that is only through a process whereby somebody really is engaged in deflection and has to demonstrate treatment and all of those things, so charges are dropped.
Thanks for that additional information. Ryan?
Yeah, I'm concerned about the timing. Hearing the concerns from some of the other committee members, it does look like there is a Marion County representative on the call. I wonder if we could get our answers now, if possible, rather than delaying or kind of a messy contingency type of approval.
I'm not hearing any opposition to that. So if that individual from Marion County would like to provide context, please do so.
This is Gary White from Marion County. Can you hear me?
Yes, Gary.
Good. Thank you for the opportunity to respond to your questions. And I apologize if our proposal was not detailed enough, because what you're all speaking about is exactly what we envision. And part of the remodel from the former center to the stabilization center is doing exactly what you talk about, making it more welcoming, making it less like a jail, making it more both from a staffing perspective and a service perspective, being able to take in individuals on their own from referral sources, from our officers who may pick somebody up, to be able to have that facility that can receive those people at any given point in time. The LEAD program has been very successful here in Marion County for many years, but it doesn't have that element. We do a great job of the warm handoff, but that warm handoff, if we don't have somewhere to take that person who needs immediate service, has been a bit of an issue. So that's why we closed the transition center, are in the process of repurposing that as the stabilization center. That includes, like I said, staffing, how we're going to bring health and human services into that building to provide services along with some of our burn partners and others. So great questions from everybody. But that is exactly what we're trying to do out there, is make a shelter, a stabilization center that is welcoming for people who are coming from all of those referral sources. You guys there?
Yes.
Got really quiet.
Sorry.
It's okay.
Thank you for those comments, Gary.
Yeah. No,
Judge
great
Shanti,
questions.
I see your hand is
So
raised.
with that information, if RJ doesn't mind, I'd like to modify it and let's just have the vote. I've heard what I needed. That's exactly what I was hoping.
Thank you.
How about you,
Thank
RJ?
Yeah, I'd like to amend my motion we got the information that we need, so I'll rescind it.
All right. Thank you all. Is there any further discussion or other questions from GRC members before we move on to a voice vote then? Okay, seeing and hearing none. So the decision before you now is whether you approve Marion County's adjustment request as presented here on the slide. Are there any abstentions for this decision? Seeing and hearing none. All those in favor, please say aye.
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 All those who oppose, please say nay. All right, then the request reviewed today for Marion County has been approved. We have two more amendment requests to get through. The one before you now is Tillamook County, who is requesting to reallocate $54,080 within their contractual services category. 12,000 of that would be broken out as 4,800 for CIT certification fees for 2 representatives at each of their stakeholder organizations. These are listed out in their amendment requests, but includes Tillamook Police Department, Tillamook Family Counseling Center, Adventist Health Tillamook, Folk Time, and Tillamook County Sheriff's Office. Also $7,200 for stipends to compensate Tillamook Police Department officers for training and outreach activities. So that's the first sub-bullet there, that $12,000 to support CIT certification, training, and outreach. The second sub-bullet is $42,080 within contractual services to fund participant supports. So that's $3,000 in basic supplies, $21,080 for temporary housing costs, and $15,000 for contingency management supplies to support treatment, retention, and behavior change. So this totals $54,080, but that exceeds 10% of their total award amount, which is why it is before you all today. But it also includes a substantive programmatic change. Oh gosh, I realized that is not on my note slide, so I apologize. But I believe that I had flagged it for a substantive programmatic change because of the CIT certification. But Avery, do you have any notes on that? I apologize.
I do not believe that it is a substantive programmatic change. I can look into it if you give me a couple minutes.
Okay. Grant Review Committee, I apologize. This may just be an error on the slide since it's also not in my notes. So let's see. Yeah, I don't believe that CIT certification fees were included in a previous budget. But yeah, I'm not sure if that would constitute a substantive programmatic change. So it seems like this actually might indeed just be my error. Judge Shanti.
Even if it was a programmatic change, it seems totally reasonable to get people trained on this, so I would vote for it anyway.
Thank you, Judge Shanti. I guess I would invite the GRC if there's any further just discussion or heartburn about maybe an error on my end. Yeah, I would invite you to speak now. And Avery, thanks for looking into it in the background. I apologize for putting you on the spot. Sam.
Thanks. I agree with Judge Shanti. And just for background, we do in our forensic team provide funding for CIT training, but for police officers. But it sounds like Tillamook is really expanding that across departments. And for this work, that would be best practice. And we're getting tremendous feedback from officers already participating in this and the training and standards leadership. So I agree, major or minor, this is kind of a core aspect to the work that the counties are trying to do.
Thanks for those comments, Sam. Chief Harnden, I do see your hand is up, but it's possible maybe Avery has an answer for us. Do you mind if I let Avery speak first?
Go right ahead.
Avery.
Thanks, Casey. Yeah, I do not have it flagged as a programmatic change, so I'm happy to update the slide.
Thank you, Avery. And that does indeed seem to be an error on my end, so I apologize. Chief Harnden.
I was just gonna echo what everybody else says. There's a big push across the state to get as many of our sworn officers through CIT training. It's actually state law in Washington, where I came from. So I'm glad to see counties and city agencies really take a look at how they can get this done. So either way, whether it's an error or not, I would suggest supporting it.
Thank you, Chief. And thank you, Avery, for updating the slide in real time. That's really cool. Let's go ahead and pause to see if there's any further discussion. Paul.
I just have a question, and that has to do with this being a planning grant, but some of the stuff that they're talking about, which actually I think are really good investments around housing and other supports, feel like implementation. So are they going to begin implementation soon? And that's why those are being included now?
That's a great question. Yeah, so it was our understanding, yes, Tillamook County has been in planning mode this entire time. They had indicated that they are moving closer and closer to implementation and perhaps even piloting something small in May, so in this month. And that is why you probably noticed those changes. But that your memory is correct. They have been planning this entire time.
Great, that's helpful. Thank you.
Okay. Are there any further questions or discussion from the GRC before we move on to the voice vote? Jeannie.
Thanks. Just with the CIT certification training and outreach, so is it, in which I think that's wonderful that this is happening, ditto to what everyone has shared thus far. Just is it bundled? I saw there was a list of other stakeholders. Does that mean they could be contractual training providers as well as those all, or are they all taking the CIT training and that's being provided by or is that what these funds also help with other than the officer time that I saw in the details?
Yeah, Janie, I can answer that question. So the clarifying point here is, the $4,800 is for CIT certification fees for 2 representatives from each of the stakeholder organizations listed. So it's 2 individuals from each of those organizations that would be going through the CIT training. Does that answer your question?
It does. Thank you.
Okay, I'm not seeing any other raised hands, so let's move forward through the voice vote. The decision before you now is whether you approve Tillamook County's adjustment request as presented here on the slide. That has been updated thanks to Avery. So are there any abstentions from this decision? Okay, seeing and hearing none. All those in favor, please say aye.
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 And all those opposed, please say nay. Okay, the amendment request reviewed today for Tillamook County has been approved. Thank you so much. And moving on to the last amendment request for your review today, coming from Washington County. And this is a request to reallocate $248,250 to support increased mobile outreach, contingency management, and warm handoff services. This is broken out in a couple different ways. The first bullet here is $90,000 total from personnel cost savings due to delays in hiring senior program coordinator and senior legal specialist. there's 40,000 that is part of that, which includes $18,000 for HIPAA compliant office pod and $22,000 for client flex funds, which include that contingency management piece and naloxone supplies. And then the other part of this 90,000 is $50,000 for a one-time investment in data tracking software that would be made before the end of the project period. This next sub-bullet, their movement request number 3, is $6,750 from training and associated travel. This is coming from cost savings due to an overestimate, and these funds would be applied towards the client flex funds, again, for that contingency management piece and naloxone supplies. And then their last requests here total $151,500 to support a new line item, which is mobile outreach support. This would be $150,000 in personnel cost savings, $5,000 from the senior program coordinator, $95,000 from the program coordinator, $50,000 from health and human services program specialist, to fund the purchase of an outreach van and essential outreach supplies such as a tent, table, chairs, as well as $1,500 from contractual services, which was translation costs. And that's due to cost savings and an overestimate. They actually have a bilingual outreach peer that they utilize now. And this request exceeds 10% of their total award amount and includes that substantive programmatic change with the new line item of the mobile outreach support with the purchase of that van. Are there any questions or discussion from GRC members? Jeannie.
Yeah, I just want to disclose, while I don't believe there's a conflict of interest with anything having to do with MHAO, which is the organization I lead, we do have one peer case manager as part of those 3 FTE, but I don't believe any of the funding. So I guess my question is, do I need to abstain and just disclose any perceived conflict of interest?
Thanks, Jeannie. So the abstention choice is up to you. But I would say the requirement is if you yourself are financially gaining from this decision, or a direct relative of yours financially gaining from this decision, I think is that threshold. However, if you wish to abstain from the vote, we do have quorum. It's not an issue if you feel more comfortable doing that.
I'm fine, and I can declare I'm not making any money off this or stand to, so I'll be fine. I'll vote. Thank you.
Any other questions or discussions from GRC members before moving to a voice vote? Okay. So the decision, oh, sorry, Judge Shanti, I jumped the gun. Go ahead.
I was just wondering, is there any other sources for naltrexone to be people to get it? They've got a lot of mention of it in here with their client flex funds, but does anyone know? I thought that we had some other funding source for that, but maybe I'm wrong.
This is Stacy Brubaker. I can chime in on that, at least from what I know. So naloxone can come from a variety of different places, and many counties have used their opioid settlement dollars to be able to get some of those dollars. But then also there is I can't think of what it's called, I'm sure Samantha knows, that allows some agencies to be able to get naloxone through a state resource as well. But my understanding is that has started to dwindle. So pretty rich opportunities, but I think they are getting to be less and less.
Sam, I see your hand is also raised. Maybe you have more context.
Yeah, sorry. Yes, Stacy's correct. I think so. The state has the harm reduction clearinghouse, limited funding there, but we do have agencies that apply, and it's usually for any agency or program within an agency that is directly providing naloxone to folks that are using drugs and are at highest risk of overdose. I do know that some Measure 110 applicants also requested some funding for naloxone. And sometimes the local CCO will also have naloxone, but it is scattered. And the one thing I will say is that the amount of naloxone currently going out into community to prevent overdoses, based on the modeling that we did, is not yet saturated enough in order to get ahead of the overdoses. So I think many counties and programs are seeking naloxone in various ways in order to try and saturate the community.
Thank you for that information.
Are there any other questions or points of discussion from the GRC? Seeing and hearing none. And I did want to also note for the record that Jeremiah Stromberg has joined us. So let's go ahead and proceed to the voice vote. The decision before you now is whether you approve Washington County's adjustment request as presented here on the slide. Are there any abstentions from this decision? Okay, seeing and hearing none. All those in favor, please say aye.
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 And all those who oppose, please say nay. Okay. The amendment request reviewed today for Washington County has been approved. So this was our last action item, a discussion about impacts, the high utilizer program sustainability. And I believe, just again for the record, so Chief Harden is departing at 12:30, but we will indeed have quorum past that time. There is a mass exodus of GRC members. Just please let us know before you hop off the call so we can ensure we have quorum for a decision. But for impact sustainability, our impacts high utilizer program is currently implemented in 11 counties and by 5 tribal governments. There were a total of 1,141 people who were served by programs between July of 2023 and January of 2025. Their existing project period is set to end, this says June 20th, sorry, June 30th, 2025, so the end of June. And there is about 2.55 million remains. The actual number is 2,555,000 that remains unallocated for impacts at this time. And those funds had been bookmarked for potential evaluation and or competitive application for capacity building at a later date. However, the future of impacts programming and the future of impacts funding is currently unknown. We are in the middle, actually nearing the end of this legislative session, and there currently is no bill that contains future funding for impacts. And so today for the GRC, we really wanted to discuss our sustainability strategies and make a decision regarding potential additional allocation. So first, the CJC is going to be offering all grantees a no-cost project period extension for 2 additional quarters, which would get folks through December 31st of 2025. That would allow programs to continue to spend down funds and also continue any programming that they have. This would be optional for grantees. They could choose to close out early and on time, at the previous project period, June 30th, 2025, if they desire to do so. But otherwise, for an opt-in process is going to be under development. We'll get that question out to grantees immediately so that we can start drafting amendments and send them out for signature as soon as possible so that the impacts grantees can rest assured that they can continue spending and programming beyond the end of next month, because that is fast approaching. We will await results then of the current legislative session and reevaluate once the future of impacts is more certain. So in terms of other points of sustainability, CJC staff went through some spending analyses and projections. And before I hop into this, I really want to provide a caveat that this type of analysis is a very imperfect process. And we only have the figures that were reported to us by grantees. And alas, of course, I do not have a crystal ball. So I can't accurately predict what can happen and will happen in the coming months. But after grantees submitted their Q3 expenditures, so January through March 2025, they submitted that to us, just like a week and a half ago on April 25th. We completed an analysis which examined spending trends over time and made projections based on a variety of different views and lenses. So we examined the percentage of the total award they had spent to date relative to their project period. You'll recall that 11 of the programs, 11 of those programs were those original impacts grantees, and they actually have had 19 quarters of project period to date, and they are currently in their 20th quarter, versus the 4 newer grantees that were added a couple years ago. They are currently in their 11th quarter of project period. So you'll see in a bit how we adjusted for that difference, but we also analyzed the average rate of spending for each grantee over the last 4 quarters, so the most recent calendar year. We estimated their carryover that they would have after June 30th, 2025, based on that average rate of spending and all the numbers that they have submitted to us as their reported expenditures to date. And then we estimated the need for what a 1 and 2 quarter extension would look like, really trying to get a better understanding of the need of grantees, how soon they would need additional funding, if at all. And there were several grantees that we identified are going to be in need of additional funding to sustain their existing service levels. So assuming all grantees take that 2 quarter extension offered to have a new project period end date of December 31st, 2025, there were a couple grantees that were identified as running out of funds before the end of next month, and then others that before the end of this new project period of this year. So according to our analyses and projections, based on the average rate of spending over the last 4 quarters and considering any carryover amount estimate that a grantee might have in terms of funds remaining in the bank, we are projecting that Wasco and Lincoln counties do not have sufficient funds remaining to even make it to the end of this existing project period, June 30th, 2025. Following this graphic from left to right, you'll see that with the additional quarters of project period extension considered, there were 3 additional grantees that are projected to run out of funding before one additional quarter, September 30th. But we did extend these analyses and projections for the entire new project period to see if there were any other grantees that may run out of funds before December 31st, 2025. And based on each grantee's Q3 reported expenditures and average rate of spending over the last 4 quarters, also with consideration to any sort of estimated carryover amount, the affected grantees remain the 5 listed here. So that's Wasco County, Lincoln County, Deschutes County, the Confederated Tribes of Grand Ronde, and the Cow Creek Band of Umpqua Tribe of Indians. So another way that CJC staff analyzed remaining funding was by examining the amount of a grantee's total award that has been spent to date, as compared to the amount we would expect them to have spent of their total award if that total award had been divided evenly among the number of quarters passed in their total project period. There are a lot of words. So the threshold for the amount that should be spent is illustrated here by the horizontal gold line. And that was calculated by dividing how many quarters of a project period had passed. That number, as you can imagine, differs among the original 11 grantees, which who have completed 19 of 20 quarters, who we would expect to have spent close to 95% of their total award amount at this time, versus the more recently added 4 grantees who have completed 11 of 12 of their quarters for their project period, who we'd expect to have spent closer to 92% of their total award amount at this time. So those newer 4 counties are like noted here with an asterisk. That's Wasco County, Hood River County, Multnomah County, and the consortium of Umatilla and Morrow counties. Through calculations, we made these denominators equal. And what you see here on the slide are the adjusted percentages for all grantees, as if they were operating on the exact same project period. So that horizontal gold line sits at the 95% spent. And through this method, the same grantees surface as having spent most of their awards to date. So shown here with that threshold of 95% spent or more, you'll see that the farthest 2 left bars, Wasco County and Lincoln County, exceed that horizontal gold line of 95% spent. If we extend this threshold to 80% and really analyzing the grantees who have spent more than 80% of their total award, the furthest 5 bars here on the left either touch, meet, or exceed that threshold, and those are the same 5 that we had estimated for that rate of spending calculation that I presented earlier. That's Wasco County, Lincoln County, Deschutes County, the Cow Creek Band of Umpqua Tribe of Indians, and the Confederated Tribes of Grand Ronde. So focusing on those 5 grantees who meet that 80% threshold, and there are the same grantees who, based on the average rate of spending over the last 4 quarters and their reported expenditures to date, these are the grantees that are kind of in this shaded box. We project that these grantees would need an additional allocation totaling $805,000, about $160. So not to exceed that amount, but that an additional allocation for each of these 5 grantees to get them to the end of the existing project period of December 31st, 2025. And that we, through our analyses and projections based on everything that was reported to us to date, the other 10 existing programs could continue spending down the funds that they have and do not need additional allocations at this time. So with $2,555,000 of impacts funding that remains unallocated, the GRC could choose to do nothing and let programs continue to spend down any funds that they have remaining, and then close out their impacts contracts and potentially close out their programs once fully expended. So that is an option that is on the table. The staff recommendation, however, is for this GRC to allocate a portion of the remaining funds to the 5 grantees who are projected to be in need of money to sustain their programs to the end of the new project period end date, December 31st, 2025. Any remaining unallocated funds would be reassessed after session and either pushed to being available as part of a future grant cycle, like a new grant cycle for impacts, or maybe potentially leverage for additional program sustainability, but to be determined and decided at a later date once the status of impacts is certain. So I will turn it over to the GRC now for discussion about this impact sustainability piece. Yeah, Stacy, why don't you kick us off?
I actually just wanted to go back to the numbers you originally gave. Maybe I'm just missing something, but I'm really shocked about the low number of people that have been served for the amount of money that has gone out the door. I assume that that was for the entire state and all the dollars we've served. 1,000. I don't remember what you said. 1,100 and, or maybe it was 400. Anyway, I was just shocked at how low the number is for the amount of investment that we have done, and I wondered if there was any information about who had actually delivered the highest numbers and are really making an impact with the dollars to determine who we give additional dollars to or not. I don't know. But again, I was just really shocked to see how low the number was given the amount of investment.
Yeah, okay. Thank you for your comment, Stacey. So first, I definitely want to acknowledge that the individuals served by impacts programs are the highest utilizers of their local jurisdictions. One individual could have a much greater financial impact on a community than a dozen other individuals who have maybe lower needs or lower risk. So although I think the total was 1,141 between July of 2023 to January of 2025. But these are the highest utilizers of jurisdictions. And the second acknowledgement I would like to make is that these high utilizer programs really differ quite a bit. And there are some programs that are designed specifically for the opening of a warming shelter seasonally to house and serve the needs of the highest utilizers of their community at that time. There are tribal programs who have maintained a consistent cohort since the beginning of their project period and have just continued to serve the same individuals at the highest needs over times until, maybe fewer of those individuals have needed those services, but have really kind of maintained this cohort. Then there are other programs who do see a very high volume of individuals served, kind of a lot of new clients and maybe some returning clients. And I think that the 1,141 may indeed sound like a low number, but there is, I guess, some weight to how much impact those individuals have on the needs of their community and the resources that they have to offer. Does that provide any more clarity,
Great.
Stacey?
Thanks for the context. I just wasn't expecting to see that low of a number.
Paul, I see your hand is up next.
Yeah, I've got a question about the timing. And so have you asked all of the grantees if they can stretch their funding through 12/31?
No, we have
No.
not. We were really hoping that we would have more information from the legislative session at this point in time. And so this is really all being shared today with the GRC and all grantees on this call, but has not even yet been posed to the grantees as if they're able to stretch. But we did a really rigorous analysis of the amount of funding that they have remaining. And, we looked at average rates of spending over the last 2 quarters, over the last 4 quarters, with and without estimated carryover amounts. And so with our projections, it seemed that, many of those people fall below the expected threshold of where they should be spent and could indeed stretch their dollars with the existing service levels and programming that they have, not like increasing or making any big changes.
I guess I worry a little bit about setting a precedence for counties that overspend that will come and bail them out. And I guess the other part of that is, so if the legislature reauthorizes impacts, would the funding for the counties that are getting the extension, would their funding start January 1st, whereas the other counties' funding would start at the beginning of the biennium?
Okay, yeah. Let me address your first point about the overspending. There are currently no grantees who have overspent. You'll see that Wasco County is listed here as having 100% of their wards spent. That is their adjusted rate. They have basically spent every cent that has been distributed to them as part of an allocation of their funding disbursements over time. But they have not spent more than we have given them. They have just spent at the exact rate that we have been giving them money.
I guess it's the rate of spending.
Okay. I see. Okay. Yep. I see what you're saying. So that the rate of spending, where people are spending maybe more than their actual disbursement. To that end, I would say, a lot of these grantees experience crazy challenges and obstacles as part of standing up their programs with the hiring and COVID pandemic and all that, and have finally gotten their feet underneath of them, and then through maintenance funding and gap funding extensions of the existing project period, their disbursements have also changed over time and may have actually decreased significantly like 2 years ago as compared to their initial award. If they were like, hey, we need to just coast on the money that we have. I can think of one grantee that's the exact case for. So the rate spending, it's definitely an imperfect process of analysis.
And then the second part of my question about the timing.
So it is the CJC's intent of closing out these contracts and programs at December 31st, 2025. Should there be additional funding allocated to impacts, it would be, I think, the best interest to have a new project period, a new application, a new competitive process for existing and possibly new programs to apply. The continued extension of project periods has made it, a very challenging accounting for a lot of these grantees. And this GRC has expressed a lot of interest in rigorous evaluation of grantees and wanting capacity building and other applicants to be considered. And so unless something radical happens as part of this session, that is at least the CJC staff recommendation, is to really close out these contracts at the end of this year. And so in terms of when the new one would start, I couldn't even say it would be January 1st. We'd have to go through some sort of application process and competitive review, which, as you know, takes quite a bit of time. And so that would have to be decided and would hopefully maybe match up with a biennium, like our other grant processes.
So I guess the only thing I'll say about that is I hope that you would be able to create a project period start that would guard against potential lapses in funding between cycles, because I think it's very difficult for counties to have programs operationalized and then have a 3 or 6 month gap between a new project start date and funding eligibility.
That is a very reasonable comment. And I think that, with all the optimism in my heart, with more funding for impacts, which currently does not exist, but like with more funding that maybe will come out of this session, perhaps, letting any original grantee who reapplies for funding to be able to backdate to that particular point in time that their existing project period ended, I think is something that we could consider. But it's so hard to speculate and come out with a full flow chart of workflow and all the different possible things that could happen until we know if there's going to be funding and a continuation of impacts or not. As it stands right now, impacts funding is not included in the governor's recommended budget. And so as it stands right now, there is no more impacts after June 30th. But hopefully, at least sustainability-wise, through December 31st, with a potential allocation to get these ones stretched a little bit further, and no cost extensions for other folks to continue programming and spending money down.
Great, thank you. That's helpful.
Judge Shanti.
Well, I want to follow up on the discussion about the serving of 1,000 and I don't know what it was, 4 people for what, $20 million. I understand that what you said about different people cost different amounts of money to each system. I'm hesitant to just say, let's give the 800,000 to extend the people that have these programs without knowing if the programs have shown any efficacy at all, because I don't know that. There's a lot of programs and 104 people. If one of these programs is going to get a chunk of money and they've served, I don't know, 2 people, that would affect my analysis. And then the second thing is, it sounds to me like the legislature is not going to pump more money into this program. I can't see them doing that if it's not in the budget and there's no bill for it at this stage. So I wonder if that money would be better allocated to do something else. Like, do we already have all the money we need to really drill down in the analysis of what these programs did and who they served and how effective they were and which practices were really the best practices that were the most effective for the county that was, that county's situation? Do we need more money for that? And if we do, will we have that money if we give this $800,000 to extend to these other programs?
So there would be money that remains. So of the $2,555,000, if $800,000 is allocated to that, I think that leaves about 1.7 million and change that remains unallocated. But as far as the rigorous evaluation of what programs have done, the people that they've served over time, whether or not best practices could be explored. Really, there has not been time. There is not time, to complete such an analysis before June 30th. Even with the 2-quarter extension, if impacts is not included as far as a stretch, as far as additional funding from the legislature and additional appropriation, I'm not sure if it would be in this GRC's best interest to spend, efforts and time in a rigorous analysis for retroactive understanding. We will include something as part of our annual report. But yeah.
All right. Well, I want to argue a little bit against that proposition, because all along, at least my understanding, when this whole thing was started, the goal was to extract from these programs the best practices, what worked in the various, in light of the various communities situation, rural, urban, etc. And just doing a report and saying, here's what it is, without really mining every scrap of information to come up with, yeah, this seems to work, this is a bust, that we can then build on for future, or just disseminate out to the counties and providers, etc. It seems like a lost opportunity, and it seems like part of what our mission was and our charge was at the very beginning was to do exactly that: extract the information and get a good analysis. Now, if we don't have time to get that analysis by the end of the period, December or whatever it is, could we contract with a competent data analyzer person? I don't know. We've been using, I don't know who we've been using, Northwest.
We've used OHSU and the CHSE, and there are grant cycle evaluations that, even on today's agenda, Stephanie Renfro from CHSE will present an evaluation looking at the effects statewide. So there are explorations into that kind of data analysis that have happened and are paid for to date.
Yeah, so we have those, and if we could, last time we had people represent or speak on what the data they've collected, there were a lot of questions I thought that board members had that couldn't be answered because they hadn't done the analysis, they hadn't drilled down that way. So I'm just saying, I would really like to think about entering into a contract like what you just said counties can do. They don't have to spend all the money as long as they've contracted for it. They don't have to spend all the money before the end of the period, to make sure that we actually do fully 100% utilize every scrap of data we've got to come up with what the best practices are. I would rather do that than give money to continue a program that just on the face of it is not very effective. And I don't know. I don't know if these 5 programs that we're talking about are very effective. I can't, I don't have a master of that information. So anyway, it's just a suggestion that I see a lot of what happens in these commissions and these pilot projects. A ton of work goes into them, and then frequently I feel like, oh man, we didn't really get out of that the information that we could have garnered. It's like there's a report done, move on. And I just would like to see us really, for $20 million, come up with some really usable information.
Thanks for your comments, Judge Shanti. Michelle Moore, unfortunately, the time for public comment has passed, and we do need to focus on GRC discussion for this action item at this time. So I'll ask that you lower your hand, and Ryan, I'll turn over the conversation to you. You're on mute, Ryan.
I'll follow up on that, I guess, as co-chair, maybe invite Michelle. She's with the governor's office in case there's some insight that could support this conversation.
I'm actually the social services officer for the Cow Creek Band of Umpqua Tribe of Indians. So I am not, yes, I am not. We are an impacts grantee, and trust me, I have a lot to share and convey, but I will get with Casey and find out the best way to do that.
All right,
Thank you.
My apologies. I got
Sorry.
thrown off by the GO on the
That's the tribal government office. Yes. Thank you.
If I may, Casey, I just add, Judge Shanti, I do appreciate the statements say you passed along. I think that I would again lean on timing as it relates to this matter and where we're at. With enough leftover still in the bank, I think this is an active conversation to pursue. Next, I think this committee has in the past already kind of determined that it wants to see performance-based or focused efforts in any grant funding, and a report like you describe, and some of what we'll hear from CHSC here shortly, and maybe in the future could certainly help to inform that. But I do err on the side of urgency for the folks because the programs do seem to be producing. Our annual report does suggest that we're seeing good results, at least good enough for my comfort level, and giving them a little bit longer till we can make a real robust evaluation and grant making process oriented on performance.
Thanks for your additional comments, Ryan. So the GRC can choose to do nothing. That is an option today. In which case, the no cost extensions will be provided to grantees, and they can continue spending the total award amounts that have been allocated to them at this time until the end of this year, and then close out their contracts and programs, as they run out of funds. There is also the option to allocate a portion of the remaining funds to the 5 grantees that the CJC analyzed and projected as running out of funding, 2 of whom will run out of funding before the end of next month. That amount is $805,160. I would invite discussion from the GRC as to a way forward, and with this action item to do something or to choose to vote to do nothing. But I would ask that we do have a decision on record before moving on to our other agenda items.
And Casey, can you remind us what staff's recommendation is?
Yes, Paul, sure thing. So staff's recommendation would be to allocate $805,160 approximately to the 5 counties listed here, or excuse me, 5 grantees listed here: Wasco County, Lincoln County, Deschutes County, the Cow Creek Band of Umpqua Tribe of Indians, and the Confederated Tribes of Grand Ronde, in amounts not to exceed what is listed here on the slide. So they could choose to accept less. And this $805,000 and change would be coming out of the existing unallocated funds, which is $2,555,000. So it would be staff's recommendation to make this allocation to get folks to the end of December 31st, 2025, with the extension of their project periods. Alicia, I see your hand is up.
Yeah. Are we meeting again this summer, or we have quarter? I didn't know. I mean, I guess it probably, as I listened to you, it wouldn't make sense for us to put this off for those that have already spent and won't have money by the end of June, right? Even though I think we're set to meet again in July. Is that correct?
There are no
Or August?
other GRC meetings on the schedule. They really was kind of waiting for session before that was put on the books. And your understanding is correct that it probably would be prudent for the GRC to make a decision before the end of June 30th, 2025, especially for the two grantees, Wasco and Lincoln counties, that are projected to be spent by that time.
Okay, and that could also, depending on how the session goes, the composition and the way that this committee, that also may change as well, as I understand it, potentially. Is that correct?
Yes, to an extent, but more, at least my understanding, and Ryan, I'm sure you can speak to this, more as it applies to the behavioral health deflection grant program, not
This
to.
within this at this time in the impacts. Okay. Thank you. I do. I mean, I appreciate what Judge Shante said. I mean, I think there's, as when I came onto this committee 5 years ago or whatever, I was really excited to see that we were, as a state, looking at these individual counties, what they're doing, and then being able to look at what the impact is so that we could model those programs in other areas in the state was the hope, I think, when we started, was how do we get funding for some of these programs that have been really successful so that they could move them out further than just that county, that model. So I hope we do something with that or look at a way that we can do that moving forward and that doesn't get lost in this. So thank you.
So Casey, are you looking for a motion from membership?
I think I am looking for a motion at this time. I don't feel comfortable, or I guess I could say, that we could do a voice vote with a decision being approve what's on this slide, but I also could entertain a motion.
This is Jeremiah. I'll entertain a motion to adopt the staff recommendation of moving the $805,159.56 to the 5 counties as outlined on the slide. Thank you.
I'll second that.
The only friendly note that I would probably want to add about that motion is that Jeremiah did say counties, and there are 2 tribes listed here. It's semantics, but I think maybe, do you want to maybe do a friendly amendment, anyone?
Yes, thank you. I appreciate that. I'll adjust my amendment to recognize that it's 3 counties and 2 tribes. Thank you.
Shouldn't we also add that it extends it to December? For all the counties, or I mean, all the grantees?
Yes, so the CJC will move forward with those no-cost extensions. It does not have to be included in this vote. But that will happen, Judge Shanti. But if you would like it to be part of the vote for the record,
if it's not needed, no.
Okay, yep. Then rest assured, yes, the no-cost extensions will be offered to all grantees, and yeah, it sounds like the motion has been seconded. So we can proceed with a voice vote. Are there any abstentions from this decision?
Steve Gunnels, I'm abstaining.
Okay, thank you, Steve. So the decision before you now, as Jeremiah kindly put, is really to do these additional allocations to the 3 counties and 2 tribes listed on the slide. The amounts listed here are up to amounts, so not to exceed this amount. However, a grantee could choose to accept less if it is not needed. But all those in favor, please say aye.
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 Right. And those opposed, please say nay. Okay, that decision has been made and the additional allocations approved. We are going to move next to inviting our friends from CHSE to share a bit about the evaluation, the impacts statewide evaluation, which may provide some more context as to the impact that these impact programs have had. Let's see, I think, Stephanie, okay, I see you there. Let me get your slides pulled up. 1 second.
Thanks, Casey.
Okay, thanks for your patience. And let me know when you'd like to advance, Stephanie.
Yeah, sure thing, we'll do. Hi, everyone. I'm Stephanie Renfro with the Center for Health Systems Effectiveness, or CHSE, at OHSU. And I'm hoping I'll be able to meet the calls from Judge Shanti and others to provide some information about the efficacy of the program. So go ahead and advance, Casey. Our center was contracted by CJC to serve as an independent external evaluator for the Impacts program. We're charged with providing a robust assessment of whether the program is meeting its intended goals to complement the local work that's happening by the OHSU PSU School of Public Health team, who you'll be hearing from next. Our evaluation uses administrative data and robust statistical methods and also incorporates local findings from the School of Public Health team to inform our study design and interpretation of findings. Go ahead and advance, please. So my last presentation to this group covered results from our baseline report, which was released in 2023 and described the impacts target population and their service patterns just before the program kicked off. So I'm excited to be back with you today, now that the evaluation is underway, to share results from our first funding cycle. And this is when services were newly rolling out. What I'll be sharing today are just highlights. I really encourage everyone to read the full report, which is available on CJC's website. And go ahead, Casey. Our evaluation uses circuit court filings, Department of Corrections records, Oregon Health Plan claims and enrollment data, and state hospital records that are all linked at the person level. I want to underscore that it's not usual for these data sets to come together in this way. We've invested a lot of time to obtain data sharing agreements across the agencies that collect these data in order to provide the most robust evaluation possible. And now that we have all of those agreements in place, it's really quite straightforward to receive updated data extracts over time so that we can continue evaluating as grantee programs mature and new ones get added. We're already funded to do the second grant cycle evaluation. I'll get to that later, but I just want to underscore all of the upfront investment that has kind of created this evaluation framework. Next slide, please. This map highlights regions of the state with impacts programs in dark blue here. And a huge advantage of relying on the administrative data that I just showed you is that we can identify target population members and their outcomes across the whole state, even in regions that don't have impacts programs. And this provides a comparison group for the evaluation, which lets us tease out changes that can be attributed to impacts rather than other external factors that affected everyone in the state. Examples are COVID and the Measure 110 implementation and Judge Mossman borders that had huge effects on the state hospital during the evaluation timeframe. So really having a comparison group is what allows us to make robust assessments of whether the program's meeting its intended goals. Next slide, please. Our evaluation design accounts for the staggered implementation of programs, since we all know that most grantees didn't roll out services on day one of their funding. And this first cycle evaluation assesses changes that are attributable to the 10 grantee programs that you see within the light blue box. And these were the programs that were actively offering services by the end of the first grant cycle, June 2022. Next slide, please. We used a consistent target population definition for our evaluation that leveraged the administrative data that we have access to. Our definition identified high utilizers over 6 months increments. So that would be January through June and July through December. based on people's interactions with the criminal justice system, ED visits and hospitalizations, and state hospital stays. You can see the criteria listed here in each of those boxes, and individuals can qualify via any of these channels. So you can imagine a big, like a big or in between each of these criteria. Any of these would get you into the target population. Go ahead and advance. Now, grantees are also collecting and reporting data about the individuals they serve through REDCap. But the administrative data that we have allows us to answer questions about everyone in the state who's in the target population, not just those that are reached by impacts programs and who receive services. So we'll share just a few findings from our report. If you go to the next slide. This bar chart indicates how many individuals across the state met impacts target population criteria and the ways in which they qualified. And the first thing you might notice, especially given the preceding conversation, is the counts along that vertical axis. Those indicate that we're in the tens of thousands of people who qualify for impacts target population. We know from Casey's earlier reporting that right now programs haven't been serving anywhere near those numbers, so it gives you some sense of the excess need in the community. This is something that we intend to keep exploring and to dive into further in our next phase of evaluation when the administrative data timeline catches up to the REDCap data collection efforts. Another thing you'll notice is that we see most individuals qualified for the target population based on one criterion alone, with criminal justice involvement being the predominant pathway. That's that light blue bar, followed by healthcare utilization, which is the dark blue bar, and then state hospital discharges in orange. Only a small percentage of the target population are qualifying under multiple criteria, which you see in those like kind of skinny bars off to the right. Next slide, please. We can also use the administrative data to understand differences in system utilization across the different grantee regions. And you can see some of that variation here. We have regions like Union County and Klamath Tribes up at the top, whose target populations are predominantly comprised of individuals with criminal justice involvement. And then if you look down at the bottom, you can see regions like like Clackamas and Lane counties and the Confederated Tribes of Grand Ronde, who have larger shares of individuals with frequent ED visits or hospitalizations. So this information can help to inform local program outreach strategies. It can also be combined with grantee self-reported data on service contacts to get a sense of program reach. Next slide, please. By definition, the impacts target population consists of individuals with behavioral health conditions. We all know that. This figure demonstrates the high prevalence of co-occurring substance use conditions, which is in light blue shading, and mental health disorders in dark blue that affect the target population. And so the way we've illustrated the co-occurrence is with those kind of diagonal overlapping shaded lines. You can also compare here the share of co-occurring conditions in the impacts target population, which is the bar on the right, or I'm sorry, the bar on the left, to the relatively much smaller share in the general population of Oregon Health Plan members, which is the bar on the right. And so again, comparing those shaded or those overlapping shaded regions, it's about 65% of the impacts target population with co-occurring behavioral health disorders versus 13% in the Oregon Medicaid population. Next slide, please. So now I'll transition to the evaluation of program effects. This is really the meat and potatoes of the evaluation work. And our evaluation takes a very broad look at the program as a whole and its effect on the priorities and the legislation that created the program. Our primary outcomes are listed here, and they focus on the program goals to reduce criminal justice involvement, ED visits and hospitalizations, and Oregon state hospital admissions. Just a couple of notes before we get into the results on what the statewide evaluation doesn't do. One is that it does not evaluate individual grantees. Again, it kind of brings it up to the program-wide level as a whole. It also doesn't explain what drove observed effects. The administrative data don't tell us this, but for those sorts of inferences, we lean on CJC staff and the qualitative work done by our colleagues at the School of Public Health. All right, next slide, please. So we're going to start by looking at criminal justice outcomes, but before I underscore the findings, I want to just give you an orientation to how the information is displayed. And so what you'll see here in the big blue box, or excuse me, the big white box, we have our outcomes listed on the left, and the primary outcomes of interest are bolded. Next to each outcome to the right, you have arrows, and that's the direction of desired change. So this tells us, do we want that, that outcome or that rate to go down or up? Next, we list the baseline rate for the target population just prior to the start of impacts. And this is just to give some context for interpreting any changes. The next column, the adjusted change column, this is the program effect. So this is the change that's attributed to impacts after controlling for other factors like demographics of the population. So this is really that column, that adjusted change, that's our main findings for the evaluation. And we use shading to highlight statistically significant effects, with blue to indicate change in the desired direction. So blue means good, and orange to highlight change that's in the opposite direction that we would hope for. The darker the shading in either color, the stronger the effect. And then if the numbers are listed with a white background, it means that there was not a statistically significant program-wide effect. Now, I mentioned before that we're not doing evaluations of individual grantees at this time, but I did want to give you a sense for where we see movement at the grantee level. And this is important because you could have no change at the overall program level, and it could mean that none of the underlying grantees were able to effectuate changes, or it could mean that half of the grantees had changes in the positive direction and half had changes in the other direction, and they kind of netted out to give you an overall program-wide null effect. So giving you this variation lets you peek a little bit under the hood at what we're seeing at the grantee level. So now to interpret the results here. So in the criminal justice domain, we had several statistically significant program effects. We saw convictions go down. That's that negative 47.3 convictions per 1,000 people. This was driven by reductions in both felony and misdemeanor convictions. That's that 20.1 and negative 28.7. We also saw recidivism associated with convictions drop by 1.7 percentage points over a baseline of 25.1%. Although not significant at the program level, we did see 3 grantees who were successful with increasing enrollment into Medicaid within 2 months following release from incarceration. That's that second to last outcome listed. And then we saw mixed results associated with incarceration rates and overdose following release from prison. All right, just letting those sink in. I see a question. I'm happy to take it now.
Yeah, I'm just curious, with a 20% reduction in the felony crime convictions, I would expect that the recidivism rate would be lower than it is. Any thoughts about that?
So first a correction. So it's not a 20% reduction. It's a, if you look next to each of the measure names, yeah, within parentheses, it kind of gives you the scale. So, so 20.1 per 1,000 people, right? And so your question is, why would we not see more movement within recidivism?
Yeah. Yes.
Yeah. So there are 2 recidivism outcomes. So one is looking at individuals who are reconvicted within a year. And then the second one is people who are reincarcerated within a year. And so we do see movement on the conviction recidivism. That's that negative 1.7 that's shaded in blue. So that was statistically significant. And so that was driven by the combination of the reduction in felony and misdemeanor convictions. We don't see any movement in recidivism, incarcerated related recidivism, and that's consistent with our finding that we didn't see a decrease or an increase for that matter in incarceration. So that 1.6, that's unshaded, we didn't see movement there, and then we didn't see movement on the recidivism for that same outcome.
That's helpful. Thank you.
Does that help clarify it? Yeah, sure thing. All right, let's move to the next slide and look at healthcare outcomes. So our most significant finding in the healthcare domain is an increase in innovation and engagement for substance use disorder treatment. We saw almost a 10% improvement on both metrics over the baseline. This is noteworthy given the high rate of substance use disorder in Oregon, and also the ongoing difficulty in increasing engagement in treatment. These are metrics that the Oregon Health Authority and CCOs have been tracking for years now, and it's really hard for them to make movements. And so seeing some change here within the impacts population is pretty exciting. We also see down at the bottom a small increase in primary care physician visits, so an increase of 0.2 visits per year over a baseline of about 3.2 visits. None of the other metrics, so ED visits, inpatient days, medication-assisted treatment for members with opioid use disorder, or behavioral health specialist outpatient visits, saw statistically significant changes at the program level. But you can see, look at the grantees with significant change. There is stuff going on at that grantee level. And so even if overall we didn't see a program-wide effect, this may indicate that there could be some lessons we could learn from grantee programs. All right, move to the next slide. Our final domain is looking at Oregon State Hospital admissions. We see that there is, or we looked at these overall, and then we also looked by the three pathways into the hospital. So aid and assist, civil commitments, and PSRB. We saw that one admission type, civil admissions, increased modestly at about 0.5 admissions per 1,000 people. You see this shaded in orange since the program goal was to reduce state hospital admissions. An increase would be in the opposite of the desired direction. Although it's worth bearing in mind that the time frame of this evaluation coincided with really large shifts in the composition of patients being admitted to the state hospital. Judge Mossman's orders made it so that forensic cases were taking precedence. Civil cases were all but crowded out. And so it's interesting, I would say, to see this result in that context. We'll continue to monitor these outcomes as well as all the ones that you just saw in the preceding slides as the evaluation continues. You could go to the next slide. So just to recap, the statewide evaluation thus far has found that Impact Cycle 1 programs were associated with decreased convictions and associated recidivism, increased substance use disorder treatment, modestly increased civil admissions to the state hospital. These findings highlight the early effects of impacts, and I would really emphasize early. This is Cycle 1 only, and this is when grantee programs were really in their nascent stages of development. I had primed CJC to be prepared for no significant findings at all in the months leading up to the release of the report, given how short our post period was when we had to evaluate changes. I had said, we might not see anything yet. It's really, really early. It might not be Cycle 2. And so I was surprised and kind of excited to see that we have some promising results already. We do think these results are really promising. We're looking forward, though, to the next set of data to see if the trends get stronger, if they continue, if we see any movement on any of the other outcomes. Next slide, please. So no study is without its complexities and its limitations, and this one's no different. And so I wanted to share just a few considerations that we bore in mind as we undertook this evaluation work. One is impacts didn't roll out in a laboratory. We weren't able to hold the rest of the world still while impacts kind of tried its thing. It represents one of many efforts that were going on during this time period to combat the SUD crisis, improve the behavioral health system delivery, redirect individuals with behavioral health needs away from criminal justice system and toward treatment and rehabilitation. Our evaluation timeframe also coincided with the COVID-19 pandemic, which introduced an unprecedented shock to the system. We saw delays in court proceedings and crowded hospitals and admissions pauses at the state hospital. And it also created barriers for newly funded impacts grantees to stand up their programs. So this is just to say we don't want to minimize the difficulty in attributing changes to impacts. Though, as I've mentioned, having a comparison group greatly bolsters our design because it allows us to control for these external factors that affected impacts and non-impacts regions of the state alike. A second consideration is the fact that one of the key features of impact is the flexibility that it offers grantees to define the focus and scope of their local programs. As I've said, the statewide evaluation assesses the overall effects of these programs collectively without identifying which specific program elements, whether that's the target population focus or outreach strategies or specific services, contribute most to the observed variation that we see in grantee outcomes. Neither does it distinguish between grantee programs based on their level of maturity or robustness of implementation. So we really, once programs started offering service, we kind of said that the flip was switched and we called them active. But we know that in reality, services likely improve over time as programs gain momentum and referral pathways strengthen and so forth. So again, I look forward to the cycle 2 evaluation to see what more we see. Let's see, the last one, rare outcomes. Several of the outcomes that you saw listed in the preceding slides represent rare events, even among this target population of high utilizers with complex behavioral health needs. Examples of our particularly rare outcomes are overdoses and institutional placements. These can lead to noisy trends that make it challenging to draw definitive conclusions, particularly given that the timeline, again, was short. So as our evaluation extends over additional grant cycles, the strength and clarity of the evidence will become more robust. And that brings me back to the timeline. If we could go to the next slide. So what I've shared with you so far are program effects assessed during just the first grant cycle. Our next evaluation reports, oh yeah, actually, if you could advance it one more slide. Our next evaluation report will be delivered in 2026. That is already contracted. It will cover the first and second cycles combined. So that's going to let us assess maturing cycle 1 programs, plus the 5 additional grantees, or four additional grantees that implemented programs during the second grant cycle. And then if we continue with the cycle 3 evaluation, we'll just have even more robust information to characterize changes in all of the programs that will have been active by that time. So please stay tuned. And with that, my next slide, I've shared here my contact info. Please don't hesitate to reach out. I've also shared a link to CJC's website where you can find a copy of the full evaluation report as well as the baseline report. And Casey, I know we've been running over. Do we still have a little bit of time for any more questions and discussion?
I think if there are a couple questions, we could entertain them.
Okay.
No questions. Thank you for this work. Very insightful. I think as Ryan prefaced earlier, we're seeing some good results. There's certainly been a positive impact, so appreciate the work that you all did on this.
Thanks so much.
I'm not seeing any other questions or discussion from the GRC at this time, but thank you so much, Stephanie, for being here and presenting today.
Sure thing, yeah. I'll stay on in case anything comes up later.
Thank you. Erica, I see you are online and ready to go. So we'll go ahead and pivot to our next agenda item, which is an overview of the Behavioral Health Deflection Best Practices Report that was published by OHSU PSU School of Public Health. And Erica Simeon is here today to present on that. And Erica, would you like to share your screen?
Yeah, 1 second here. Hopefully I'm doing this right.
Yep.
Did that work?
That worked.
Okay, great. Hi, everyone. Thanks for having me present today. I know a lot of you know me already, but for those who don't, my name is Erica Simeon, and I am the project lead for the Deflection Data Team. Our team is under the direction of Dr. Elizabeth Waddell at the OHSU PSU School of Public Health, and we were contracted by the Oregon Criminal Justice Commission to conduct several activities for the evaluation of the behavioral health Health Deflection Program, or BHD for short. And today we're going to talk about the best practices report. And there we are. So our first key activity was developing a data collection system to be used for the statewide evaluation, as well as monthly reporting to BHD grantees and the CJC. And the database went live on September 1st, 2024, and we are continuing with ongoing data collection, providing detailed reports to the CJC every month that will be used in upcoming reports to the legislature. And then our other key activity was writing the best practices report that was submitted to the legislature on April 1st, 2025. So before we dig into actual best practices, I'd like to do a quick overview of what sources informed the report, go over some terminology, and then how the report is organized. So our team utilized multiple sources to determine national best practices and how they relate to programs in Oregon. First, we conducted a comprehensive literature review of programs in other states across the nation. This involved looking at research manuscripts, local evaluations, and program reports. We consulted with subject matter experts in the field of deflection and clinical practices for substance use disorder treatment. And then to better understand the Oregon context around deflection, our team conducted qualitative interviews with grantees in the fall of 2024, when most programs were in the program planning phase, in addition to a thorough review of BHD grant applications and grantee quarterly reporting to the CJC. And then finally, we conducted a preliminary analysis of statewide program data that was submitted by grantees between September 2024 and March of 2025. So next, I'd like to just go through a few definitions to help provide everyone a baseline for understanding deflection within the context of the report findings. So generally, deflection is defined as a collaborative approach between law enforcement and public health systems to create community-based pathways to treatment and services for people who have behavioral health disorders. And then this is without their formal entry into the criminal legal system. So it is important to understand, though, that certain types of deflection can potentially involve arrests, but again, without those formal charges and entry into the criminal legal system. And then this leads us to what are called social referrals. So this is an umbrella term for any type of deflection that occurs with no charges or potential charges present at the time of referral. So these efforts are focused on preventing involvement in the criminal legal system for individuals with those behavioral health or social needs. So I also want to briefly review the 6 established pathways that are key to deflection programming. These are the mechanisms used to refer individuals to deflection programs. So they basically outline the who, what, and where involved in the process. So we have self-referrals, where an individual voluntarily initiates contact with law enforcement or first responders without the fear of arrest. We have active outreach, where law enforcement or other deflection staff encounter known individuals in the community who are in need of treatment and services. Naloxone Plus is where individuals, as part of an overdose response, are referred to programs. It also includes distribution of naloxone to people with substance use disorder. Then we have first responder and officer referral. So this is where law enforcement or other first responders engage with individuals as a preventative measure and provide referrals to treatment and services. Then we have officer intervention, where a law enforcement officer makes an arrest or identifies a basis for a criminal charge, but refers the individual to deflection. So it's important to note here that this is the only pathway that must involve law enforcement, and it is not a social referral because it does involve those criminal charges or potential charges. And then last, we have community referral, where a community-based behavioral health team engages with individuals to de-escalate crises and refer individuals to treatment and services. So as we know, deflection is a complex process involving multiple partners and varying needs of individuals. In addition, the programs in Oregon were given latitude to create programs tailored for their specific communities. So the question becomes, how do we approach trying to understand what is happening with this wide diversity across programs and individuals? So there are actually, excuse me, certain elements that are common to all deflection program models, which is what we use to build a framework for collecting data as well as identifying best practices. So this framework includes model elements that correspond to each step in the deflection process. And these elements are program eligibility criteria, who is the first point of contact in the deflection process, what was the deflection pathway that was utilized, the type of handoff used to refer individuals to the program, and then how programs define individual success. So let's take a look at how the report is organized. So the report itself provides a high-level overview of program models and findings at all points of the deflection process. It includes best practices for programs and also recommendations to the Oregon legislature for supporting deflection programming. This report, or the report, excuse me, represents a series of deflection topics, and each section begins with an analysis and discussion of the national landscape of deflection. Then for each topic, we also present key findings that are organized into 3 categories based on the strength of evidence that was found in the literature. First, best practices are program elements and practices with well-established associations with deflection outcomes that are published in peer-reviewed literature or program evaluations. Then we have practices with emerging evidence, and these have less evidence but have been researched across multiple localities nationally with evaluation results where efficacy is described but not measured. And finally, we have common practices, and these appear frequently in the literature but without current evidence of impact on program outcomes. We also provide context around how Oregon programs are operating using data from qualitative interviews and our statewide data collection system. And then finally, we include any resources available in the literature, toolkits, and other web-based resources that would be helpful for programs. So for this presentation, we're going to really focus on the model elements, and we will walk through each one looking at the national best practices and then the Oregon context. So first we have eligibility criteria. Deflection eligibility criteria are not standardized, and there is really no one-size-fits-all approach. However, restrictive criteria can pose barriers to expanding a program's reach, especially when criteria are implemented without considering individual cases. So emerging evidence shows that programs have increased the number of referrals by expanding their eligibility criteria to things such as individuals on community supervision, those with previous deflection involvement, or other charges such as low-level quality of life crimes that occurred along with a PCS charge. It was found that a common practice among programs is to exclude people with a history of violent or person crimes and more serious drug crimes such as commercial drug trafficking and possession with the intent to distribute. So an early look at Oregon statewide data showed the reasons why individuals who were referred to deflection were found to be ineligible. The figure here displays the most common types of exclusion criteria for participants as of March 3rd, 2025. As you can see, most people had a prior disqualifying conviction or did not attend their court appearance. Interviews revealed that most counties chose to start their programs with eligibility restricted to individuals with standalone PCS charges, but they left the door open to broadening criteria after seeing program results. And then several counties with newly operational programs were already contemplating expansions of the eligibility criteria at the time of the interview. So the evidence base for the effectiveness of each pathway is still developing, but the LEAD model in particular has been the most widely studied. LEAD was cited as utilizing best practices for the officer intervention model, which has been shown to reduce substance use, reduce property crimes and recidivism, increase treatment utilization, reduce emergency room visits, and reduce arrests. And to maximize the reach of deflection programs, emerging evidence supports utilizing multiple pathways within a program. A national survey from 2020 showed that deflection referrals were actually fairly evenly distributed across the 6 pathways. And then while not well researched, social referral pathways are a common practice for many programs nationally and are utilized as much as officer intervention. So looking at the chart here, statewide data show that while law enforcement intervention is the most common pathway currently used in Oregon, grantees are also starting to utilize first responder referrals, active outreach, and community response alternatives, which allow for social referrals outside of criminal legal involvement. From the interviews with grantees, we learned that they were all planning to implement or had implemented the officer intervention pathway at the time of the interviews. Excuse me. They did emphasize the importance of being able to intercept potential participants at multiple entry points. Most counties interviewed expressed the desire to start small, perhaps with establishing a successful officer intervention pathway before expanding to other pathways. And then over 2/3 of counties offer or are planning to offer multiple deflection pathways for social referrals that do not involve any formal charges. So the first point of contact is the individual who first encounters a person that they decide to refer to deflection. So the involvement of law enforcement or other first responders as the first point of deflection program contact is cited as a common practice. According to a national survey of first responder deflection programs, approximately 80% of deflection programs gave frontline staff authority to decide whether to refer to treatment. There is emerging evidence that co-response helps facilitate connections to services. Co-response refers to having non-law enforcement staff either arriving on scene while law enforcement is still present or traveling to the response site with law enforcement. Deflection co-responders could include peer support specialists, recovery coaches, case managers, or crisis workers. And then the statewide data in this figure show the roles of people who are the first point of contact for potentially referring individuals to programs. So in Oregon, the vast majority of deflections are initiated by law enforcement. The second most common is through the district attorney's office. There are several programs in Oregon where participants are referred to the program by the DA's office through screening, arrests, and charges for PCS. And at the time of interviews, all local program models involved law enforcement as the first point of contact in the deflection process, with over half indicating they also intend to utilize first responders, mobile crisis, and other community partners. So after a deflection participant's first point of contact, a handoff to the deflection program occurs by way of referral to program staff. More than half of the deflection programs from the national survey in 2020 reported providing a personal introduction to excuse me, to program staff, also known as a warm handoff, where you have that person-to-person connection. About 2/3 of those programs also provided transportation to an initial treatment or service provider appointment. And the national literature cited several things to consider when developing the handoff process. We know that 24/7 warm handoff availability has been cited as a best practice, often with case managers responding during business hours and then mobile crisis responding after hours. Emerging evidence shows that rapid outreach may improve chances of individuals falling through to treatment and services. And when individuals indicate readiness for treatment and support at the time of the encounter, they might not feel the same way if follow-up occurs later. So, excuse me. So that timely outreach is very important. There is also emerging evidence that programs with limited transportation or geographic barriers should consider utilizing family or friends, trained volunteers, or grant funds for participant transportation to treatment and services. And then conducting eligibility screenings in the field via phone or at the location where assessments and services are delivered can facilitate connecting with individuals. So the figure presented here shows the counts of the various types of handoffs utilized by grantees as seen in the statewide data. Over half of deflection program participants are receiving some type of warm handoff to programs, with the remaining receiving instructions of some sort to report to program staff. And then during qualitative interviews, most grantees were still planning and had yet to implement their programs. They discussed potential barriers and facilitators to warm handoffs in their communities. Most counties did not have adequate staffing to cover warm handoffs 24/7, but mentioned that as a desire for eventual program expansion. Limited transportation in rural areas also made reliable warm handoffs more difficult to implement. A few counties were utilizing a crisis center for their deflection programs, which may help facilitate participant handoffs due to their expanded hours and staffing. And finally, we have success. So determining what constitutes a successful deflection for individual participants can vary widely, often depending on the stated goals of the program. There really is a clear lack in the literature regarding a standard definition of individual success or deflection endpoints. However, defining and tracking success is a critical component of every program, and this is for participants, partners, and community members alike. Some common success criteria used by programs nationally include things like completing an intake assessment, connecting to treatment, treatment attendance, and then having an open-ended program length. There is, however, emerging evidence for programs to use an individualized approach to defining success, meaning there is no rigid standard deflection plan or timeline for completion. Some program models, such as LEAD, use a harm reduction approach and define individual success as any step taken to improve clients' quality of life. For example, reduce substance use, connections with family and friends, and then improvement in living situation. So most programs in Oregon define successful deflection as meaningful engagement by participants with a recommended treatment plan as determined by program staff. Some do require additional criteria such as completing an SUD assessment and substance abstinence based on drug testing. In the figure here, we see that the most common reasons are the most common reasons for not completing a program involve being lost to follow-up and then not engaging in the treatment plan. Interviews revealed wide variation in program definitions of success. Some programs required one engagement activity or a post-assessment step towards a treatment plan, while others required multiple months of consistent program activity. About half of counties mentioned that an individual's PCS citation is dismissed after meaningful program engagement, and that engagement is determined by program staff as opposed to meeting a specific completion metric. Grantees also noted a potential difference between what success means in terms of their deflection program and then what success may mean to an individual outside of the scope of a deflection program. And I know we're running low on time, so I'll just briefly touch on the report does provide additional content about program planning, program implementation, and then program evaluation. And with that, I can take any questions that you might have. And I'm going to try and stop sharing. There we go.
Thanks, Erica. I'm not seeing anyone come off mute or raise hand with regard to questions. Judge Shanti maybe is hopping in.
Is there a way that you can take this data and look at the individual programs so that we can see how the individual programs are doing and then extract from what they're doing, what would be the best practices or maybe even negative practices?
Yeah, absolutely. We do have it set up so we can look at it by grantee and by program element. So we can potentially look at the different elements that programs are using and compare those and see potentially like what type of program model is actually getting more people in programs or helping more people successfully complete programs. So we will have that ability, yes.
Well, thank you, Erica, for being here today and presenting on the BHD best practices report that you all put out. I think we can move on to the next agenda item, which are some county BHD program updates and data updates. Get the screen shared. So the 27 current behavioral health deflection programs have a little over a month and a half remaining in their project periods. There was additional funding in the amount of 40 million for the biennium that was included as part of the governor's recommended budget, as well as a variety of changes to the program that have been proposed as part of different bills and amendments. However, nothing is final or set in stone until sine die at the end of June. So until the future is certain, these BHD programs remain in a holding pattern and they have encouragement to continue their programming and their spending until June 30th of 2025. Grantees will, of course, be notified of any changes or any possibility of project period extension as soon as that information becomes available. But I wanted to provide a couple of programmatic updates today and being mindful of time, so you get some data updates as well. But as part of Q3 reporting that was submitted to us in April, the CJC asked grantees to identify themselves which nationally recognized deflection referral pathways were being implemented by their programs. And the results are shown here and reflect what the grantees reported to us as part of that Q3 reporting. Erica, as part of her presentation, went into details about what these pathways are. The only, I think, additional piece of information that I wanted to provide is that the first responder and officer referral pathway is sometimes referred to as officer prevention. And so we have included that here for sake of acronym and abbreviation simplicity. And so the nationally recognized referral pathways are identified here on the left with their corresponding acronyms. And you can see the 26 programs that are fully, operational. And then there is the additional Tillamook program that is becoming operational, as soon as this month is what they've identified. And so they're also included here with some pathways that they've chosen to explore. The next part I wanted to quickly highlight is county BHD program administration. There have been several different approaches that folks have taken as to where a program is housed. And the table on the right here reflects our most up-to-date numbers that were reported to us in April of 2025. You can see that almost a third are housed as in a behavioral health entity, almost a third are housed in a sheriff's office. And these program, administration houses have actually changed over time for some programs based on lessons learned and, coordination capabilities, capacity, et cetera. So that's something that we have continued to see change over time. Another thing that has changed over time is eligibility criteria for these county BHD programs. So currently, as of April 2025 for Q3 reporting, there were 5 counties that specifically defined their eligible population for their BHD programs to include only those individuals suspected of or charged with a PCS or PCSU. And 21 counties will include individuals suspected of or charged with other crimes alongside a PCS or PCSU. And some of those examples are loitering, misdemeanor theft, misdemeanor property destruction, prostitution, trespassing, and other quality of life crimes, as they're commonly referred to. You'll see here that only 26 programs, so 21 plus 5, or 26 programs are represented. Again, that was because Tillamook had not yet moved to operational phase. But common disqualifiers among programs that we have seen reported to us include a history of violence or sex crimes, whether an individual is a resident of a specific county, or if an individual is currently on supervision of any kind. There are several counties who are continuing to evaluate criteria for expansion after having reached that 6-month mark. Some grantees have evaluated with every month that has passed or every quarter. And some grantees, really wanted to wait until 6 months of implementation before making the adjusted changes. This is something that I think we will continue to see change over time, but may be informed by some of the best practices that we learned from the report. But those are my updates for programmatic elements. Before I pass it off to my colleague Will for some data updates, are there any questions on the programmatic aspects? Okay. Will, I am ready to navigate and advance slides at your request.
Perfect. Thank you so much, Casey. Can everyone hear me okay before I get started?
Yes.
Perfect. Thank you again. So good afternoon, GRC members. I'm very pleased to have an opportunity to share with you a behavioral health deflection data update today. I just want to provide just a little bit of context because you have already seen data today in a previous presentation relating to best practices. So that data largely looked at the first 6 months of implementation as well. However, we continue to track data and receive reporting. So if there are some items that overlap from the previous portion, just know that the dates are different. And so this has slightly more, about 6 more weeks of data. So we'll be able to see slightly more in some cases. Next slide, please, Casey. Thank you so much. So I just wanted to start with an overview. As you'll see here on the right-hand side of your screen, there is a map that reports deflection events by county. There are some asterisks. Those counties are active and in receiving referrals. They do, however, have a very limited number of referrals right now, in some cases 1. And so we do want to be judicious and not re-identify individuals when there are still very low numbers in a program. So as a refresher, deflection counties report their data to the CJC via the REDCap data system that is maintained by the OHSU PSU School of Public Health. And then not just new clients, but any updates to existing clients are expected to be reported monthly within this data system. And then as you can see here on this map once more, 24 of 27 Oregon programs have referred at least 1 individual to a deflection program. And so 1,118 individuals have been referred to deflection at least once. and that totals 1,180 total deflection events. And so the difference there is in many cases duplicate. So I just want to say a quick word about duplicates as Casey is advancing us to the next slide. Thank you. So of those 1,180 events, which you now see represented by that vertical purple bar on the far left of this Sankey diagram, which helps us understand flow through a system, in this case, flow through the deflection process. I just want to let you know that there were a total of 2 humans who had 4 events, 6 humans had 3, and then 44 humans did have 2 events. And so in some cases, local programs will allow a period of time to pass before someone can, in essence, try again. So that is the difference between that 1,118 and this 1,180. And so as we proceed to the right, and we will look at these in more detail in subsequent slides, oops, no worries. We see that of those 1,180 events, 926 were eligible for deflection and 249 were not eligible for deflection. And as we continue through this orange space into this vertical orange bar, we see that 723 of the 926 who were eligible did enroll. And then as we proceed to the far right side, we see possible outcomes here. Someone could successfully complete deflection. Someone could be unsuccessful in their deflection attempt, or the widest band here that is gray at the bottom right of your screen, they could still be in the program, as is the case for 412 individuals. Next slide, please, Casey. Thank you. So this is one of those times where you've already seen this relating to best practices, but just to give you a brief update on that intervening time, we still see that the vast majority of referrals come via law enforcement. That's represented by that very long bar in this bar chart that you see. And as you've already heard, local programs are exploring other methods of referral, including community referrals. But in some cases, the structure of programs can make incorporation of those other types of referrals challenging. So in addition to law enforcement, we also see substantial numbers of referrals coming from district attorney's office, as well as from peer support workers and navigators. And then the deflection coordinators themselves, as well as jail staff, are represented at a lower level. Next slide, please, Casey. Thank you. So again, something else that you've heard a little bit about today, as we could see on that Sankey diagram and on a previous slide, there were about 249 people who were disqualified or otherwise not eligible for deflection. That's roughly 1 in 5 that we've seen. And while we do see that in some cases it's relating at the bottom of this plot to in the middle of the plot, specific eligibility requirements are the most common, at least if we would take them together as a group. So largely, not attending that court appearance is something, that if someone receives a referral, there may be a length of time, and we've heard that reducing that length of time can really help someone's trajectory in a deflection program. But then there are a large portion of these, for example, the disqualifying convictions, the already being on community justice supervision, not residing in a particular county, or in some cases, a previous deflection involvement are also disqualifying events that may be related to eligibility. Next slide, please, Casey. Thank you. And then again, as we think through and look at different pieces of data as we progress through this system, when individuals enter a program, they very often have needs. And as we can see here on the left, at least in the data to date, what we see is that over 63% of those individuals who are coming into deflection programs did not have stable housing at the time of their referral. And over 63% were unemployed. And as well, over 41% required basic food assistance. And that's also reflected as we look at this plot of housing situation at time of deflection. The most common category here is unsheltered, and that is followed by personal residence. However, the next several in a row can also indicate unstable housing. For example, staying with friends or family, or living in a vehicle or a tent or in a homeless shelter. So as we see, there are some substantial needs as individuals enter deflection programs. Next slide, please, Casey. Thank you. And then as individuals enter programs, a very common early step is relating to screenings and assessments. And as you can see in the plot, Most commonly here, the ASAM criteria. In some cases, the next bar down is no assessments were administered. And then as well, we also see some locally developed screenings and assessments that are cropping up across or in use by local programs across the state. And so as this screening step occurs, what we can see is that of those who were given a screening, about 75% had an identified substance use disorder, and then meth and fentanyl were the most common substances in those cases. And nearly 29% had a mental health disorder, with depression and anxiety being the two most common. Next slide, please, Casey. Thank you. And as we've seen through this assessment and screening step, very often individuals will require referrals for treatment or other services. And again, the most common one is substance use treatment, which we would expect. But importantly, the sub-treatment referrals can happen alone and often will be associated with also a social services referral or a mental health treatment, sub-treatment, and social services referral. So these permutations are possible and represent that many individuals have needs that cut across just one service sector. Next slide, please, Casey. Thank you. And we've got 2 slides left. The first of these, if you remember back to that Sankey diagram, and we're all the way on the right side now, there were some folks who were not successful, and there were a limited number of people who have already shown or been successful in a deflection program. And so we want to look at both of those reasons for those as well. And so an individual can fail or be unsuccessful in a deflection program in a variety of ways. And in some cases, more than one reason is selected by the local program. Many of these will occur very early in the process. The individual may receive a citation and then not follow up on that citation, for example, and the local program is not able to follow them or contact them again. In some cases, it's about not engaging with a treatment plan, or a combination of these top 3, like the person was not engaging with a treatment plan and also decided to leave a program voluntarily. There are a smaller proportion, as you see down here, that had new criminal justice involvement or new substance use, and that was the reason that their deflection was unsuccessful. Next slide, please. Thank you, Casey. And then finally, I wanted to provide just a brief overview of some reasons why those who have been successful so far, what they were doing to be successful. And in many cases, completion of a program may require more than one task be completed, or more than one series of steps may need to be completed versus just one thing. And so as we see here, SUD assessment is very common. Especially this is confined only to those cases where someone was successful with deflection. So that SUD assessment is incredibly common in those successful cases. And as well, we sort of see a group together of the next 4. It's either accessing services, engaging in treatment, in some cases completing a treatment course, or continued engagement with a course manager, case manager. And those are actions that are required by local programs for an individual to be successful in many cases. And then there are a few others that are limited here that we see fewer responses for, and those are no new criminal activity or reduced substance use. And I did want to point out there are other factors relating to local programs that may be included here that simply don't have as many responses yet. And those can represent things like improved housing, quality of life, or other sort of social determinants of health. And then reductions in recidivism or emergency department visits are also possible successful outcome factors. And so that is the last slide that I have on data. I want to pause here in case there are any questions from the GRC members. Yes, Alicia Beamer, I see your hand.
Oh, thank you. This is really great data. Are we thinking that we will go back and talk to these folks again that were successful and see if, I mean, I would think housing, quality of life, ED visits over time may improve as well, but data that would be really important to capture.
Yes, I agree with you that data would be hard to capture, especially as more time
passes after an individual is completes a program and sort of maybe moves away or another thing. I'm not sure that we have plans to sort of track these individuals beyond, but that is certainly something that we can look into. We have sort of identified data with this. And so as part of our other reporting, for example, we're looking at wider system changes associated with the recriminalization of substance use or illicit substance use. And so we have a lot of the pieces there that could be done as well.
Great, thank you.
I want to provide just another bit of time for any additional questions from committee members. Okay, hearing none and seeing no hands. Next slide, please, Casey. And so I do want to turn it over to our interim executive director, Ryan Keck, for some agency updates and next steps.
Thank you, Will. Okay, so as it relates to agency updates, obviously, I think I'm one of them. As discussed earlier, I was paid the interim executive director while Ken is on assignment at the Oregon Public Defense Commission. That assignment for me and Ken is currently slated to go just through January or to January of 2026, unless sooner if a permanent director is made at the other organization. In the meantime, I will be taking on this role as co-chair for this committee, most directly related to you all, and probably making a few mistakes along the way like I did a little earlier. So please bear with me. The updates I wanted to throw out for everybody, of course, we could spend a lot of time on a lot of things, but I know we're getting close and we've been long in the tooth on this one. One is CJC's budget, as alluded to a number of times through this conversation. It's up in the middle of discussion like everyone else's right now. I know that budget decisions are certainly waiting on that forecast that will come out Wednesday this week. Then we should start seeing more conversations coming. As discussed, there is $40 million in the governor's recommended budget for the Behavioral Health Deflection Grant Program. There is not continued funding for the Impacts Grant Program currently in that, although we have been asked questions about impacts and both what it does, and who's involved and how it works, as well as what kind of funding it may need. So we've tried to answer those questions, and I know there are champions out there speaking on behalf of the program and its value. We, in addition to that, then are heavily involved in what is just recently dropped in the scheme of things, which is House Bill 3069, that being a large House bill that is looking to consolidate the grant programs of the Criminal Justice Commission, particularly for counties, to try to alleviate some of the administrative burden that comes along with applying in multiple programs, multiple processes, and over multiple timelines, to include impacts. So this Oregon Public Safety Coordination Grant Program would encompass 5 of our grant programs, would be specific to counties, to make one submission on a biennial basis for funding that they are interested for. One piece that may be, well, I should back up. One thing really important to say is this is something slated to go into effect in 2027 if it were to pass. It is not something that would affect the immediate biennium that is upon us. It would also then mean that there would still be a separate process, say an example of impacts for tribal governments interested in continuing or receiving impacts grant funds, or similarly for behavioral health deflection. So it does necessitate 2 processes, as has been done in the past. The other thing that it is meant to do is get CJC staff then out into the counties more often than we are able right now, while dealing with the multiple processes and multiple pieces of grant making, so that we can help provide additional technical assistance to the counties and other grant recipients over the course of a biennium. One of the interesting things that this bill suggests or requires is that counties provide a biennial public safety plan, which would be designed to speak to any of the grant dollars received from CJC kind of in totality, a way in which I think it's envisioned to see how maybe those intersecting programs or different uses of grant funds are meant or are being used in jurisdictions to provide interventions of different types to different populations in that county. So it could bring some very interesting insight as we continue to see overlap between not just impacts and deflection, but also in other types of programming that is at least receive supplemental funding from CJC. Those plans and the outcomes that CJC may define as part of any one of those programs to include maybe a performance-based approach to impacts like we discussed earlier. Those would all be measures utilized and checked in with each jurisdiction at a kind of mid-year point with a final evaluation at the end of each biennium. The other thing that it does is it consolidates the decision-making for all of these grant programs. And so it does remove where there are grant review committees like this one. It does in 2027 move all of that responsibility to the Criminal Justice Commission itself and redefines the seats and the perspectives that may be appointed to that commission. Commission would be expanded by its membership would be expanded and seats would be specifically defined. One being specific to an individual involved in treatment provision in the state. That's raised a lot of conversation, and I guess I'll close by saying that we know that nothing's done until it's done. And so the discussion is still out there. This bill is not passed. We don't exactly know what it will look like, but that the part of this that impacts you all in this space as a review committee is to say that I know there is active discussion about how to continue to gather the valuable perspectives like you all bring to a process like this. And CJC is keeping that very much in mind as to either what comes through in a bill, how maybe rules are defined for any program or redefined in the future, or certainly our policy decisions on how we facilitate our grant making so that we remain informed as we continue any of our grant programs, budget permitting. And with that, I will pause. Casey, I can answer any quick questions, or Casey, you can run down that list of next steps.
In the interest of time, I'll run through the list of next steps, and if any GRC members do have questions, feel free to pop on. But the CJC staff will notify all grantees of the outcomes from the decisions made today. So that will include the approved adjustment requests for the behavioral health deflection programs that were reviewed earlier, as well as the additional allocations for the 5 impacts grantees. We're also going to begin an opt-in process for all impacts grantees should they wish to opt in to a no-cost extension for 2 additional quarters through December 31st of 2025. The last little bullet that was on my list was just to await the outcome from this 2025 legislative session. So we will likely have more updates to share when things are more concrete. But GRC members, are there any questions? Okay, then the time is 2 p.m. and I think we can call the meeting. Thank you all for tuning in today. And GRC, thank you for your time and consideration.
Thank you, everyone.
Thanks.
Thank you. Bye, everybody.